On emergency meeting at 12 minutes, 13 minutes after 1. Okay, so I guess I should start off with a compliment to everybody that stayed extra hours and stayed very late and worked very hard on this. With that, I'm not going to go into a big political speech. Daniel is one to start off with overview, or do one of you two want to start with an overview? What,
Daniel?
Yeah.
Mark? You wanna touch on any of it?
So, a quick overview. The governor's plan didn't come in until yesterday, late afternoon. We were working off the national plan up until that point. The governor's plan does include 3 phases of reopening our county, and so we started out just doing phase 1, but we realized as time went on to also do phase 2 and phase 3 at the same time. We have to, of course, complete phase 1 to get the reopening plan started, and then time tells you when phase 2 starts. So, this is a draft of our reopening plan. James, Daniel, Judy, and I worked on it, and I know Daniel called James at 11:30 last night, so he was complaining. Just let you know.
Shots fired.
Sorry, James.
All I gotta say is thank God for Carmen. That's all I got.
And yes, and I want to publicly thank your wife for helping us put this into the right kind of format. So, do you want me to touch on anything else, or?
We might wanna just start going through it, honestly. So the overview, we've got cover sheet, obviously. You also have the table of contents, which covers the overview, and then it goes down into section 2, where you get into the gating criteria, the core state of preparedness, and then the reopening phases, and what's included in those phases. Excuse me, I apologize.
So Brad, do you want us to just read through this document and then
Well, I
one
guess
thing at a time?
that is not necessary for me. I would
Okay.
rather you pick out what you think were the significant changes from the original document. If there's some that you would like to make sure I captured, and thank you for that respect, but I put a lot of onus on both of you guys and the committee and Daniel and Nell and everybody else that put time into this. And so, if there's some significant changes, I think we could narrow it down to just those.
In that case, I would maybe ask us to kind of hit some highlighted areas that we have in the document. That's what we need to look at. So, if the board's comfortable with what we've done so far and what the group has done, I think it's prudent to look at. The first item, of course, is on page number 4, highlighted there at the bottom, the management action points. And that's positive cases per week. 0, really.
I think that's your criteria for the phase and what you look at.
Okay, so that was the clarification I'm looking for. So that's for what we're going to establish as the number of cases that are okay in order to move to phase number 2, or what puts us over, what that threshold basically is of cases.
So in our medical advice we got from that was 1 to 2.
Well, and they said they can certainly handle 1 or 2 positive cases in the hospital, and then there's gonna be more, they can handle more cases than that?
They can
But
handle
those are
up to 20,
hospitalized cases.
but they can handle up to 20 hospitalized cases.
But the idea is that if you get into 20, the idea of continually moving through the phases at that point isn't necessarily.
So we need to have a number
for that, and that's going to
For this
require,
Because that
additional
depends on-
discussion.
Ventilators, you know, we got 6 ventilators, so at what point do you start saying, okay, we gotta start cracking down because we're running out of ventilators?
I thought we only had about 3.5, did we get additional
I don't
ventilators?
know if we had 3.5, I've heard different numbers. I've heard between 3.5 and 6, so I don't know for sure.
The Lake Health District last month purchased 2 more. I don't know if they've arrived yet.
So
So that's probably.
since there's 3 phases, let's to meet the doctor's 20 maximum in the hospital, let's put 7 per phase. And do you see what I mean?
Mhm.
And then if we have 7 or more per phase, then the phases don't continue. Do you see what I'm saying?
Yeah.
So we have up to 7 per phase.
So I'm following you. This is management action points, and that's pretty much how the hospital can manage these cases. We're trying to answer that question
Oh,
right now.
Well, but we do
Yeah.
have that,
And,
but we do have that information, so,
well, let me say my other part is there can be 12 cases, and there might only be 2 that is actually hospitalized. They're still managing those, but there's no heavy impact on service.
Actual hospital functions.
so we could put 7 hospitalized cases.
Or, I guess, I haven't talked with the doctor.
But see,
Almost to me, it
but
seems
see,
like
it
the
says
doctor
positive
would handle
cases
that.
per week, but then it goes down into hospitalized cases. So that's where you would capture that.
Well, patients on ventilator,
Yeah, and then patients on ventilators, so what number are we looking at on that?
my suggestion is to guess would be like 2
On the ventilators or hospitalized?
on the ventilators.
Okay,
I think
So
hospitalized.
going back, so we have the hospital documentation that says they can hospitalize up to 20. And so,
If you guys are comfortable putting what the hospital can handle on those numbers,
but what
that's my only struggle, but
no, we have
Well,
those
we're
numbers.
not approving this, this is based on what we're looking at, we're wondering what would be prudent from our
Okay,
perspective.
that changes my,
But
because
this
I
still
thought we
has
were
to be
still
reviewed.
close to adopting this today.
No, I think we are adopting this today, aren't we?
Well, we still, I don't know, I'm kind of feeling like it'd be prudent to get some more input from the doctors to extend that courtesy to them.
I would agree with the doctor's part of it, I think they're,
I'd like to adopt what we have contingent on.
The numbers being, are being.
Okay, so.
Sorry, I didn't mean to, I'm not
Let's
trying
go
to
back.
be a
So-
curveball or anything.
We already have the doctor's approval on everything except for the restaurants.
I think, is Judy on, was she gonna call in for this meeting?
No.
I think if we can get a hold of Judy, she might be able to clarify some of this for us to where we can move forward with.
So I think we're saying 2 different things, Mark. We do have their approval and they're talking the numbers that they can manage to. And so we do have that. And we're changing from 20 to whatever you're suggesting here, whatever. Do we just take the numbers they say they can manage to and plug them in here?
So that's what I've done. I've taken the total number of cases they can handle at once, and that's 20. And I've divided it by 3, which is
Based on phases.
it'd be 6.5 or whatever, because per phase, and then we're not running those people over. You see what I'm saying?
I follow you 100%. Only thing I'm questioning is if the doctors agree or not.
Well,
You're just taking their numbers and dividing it into 3 phases. That's your suggestion, I can go with it.
I guess I don't see what the problem is though.
Well,
I mean,
I suppose when we plug the numbers in, I see where your confusion is coming from. In terms of the fact that we're plugging in the doctor's numbers into this document. But,
yeah, those are their numbers, they're not ours.
yeah, correct,
So we didn't make
it's
this up.
just the, you're
I
right.
don't have that.
And there's nothing saying you can't do that and have them look at it and change it later on.
That's true, because this is a living document. And that is something that we state in the and the purpose on page 1, where we discussed that the,
So I'm not making any numbers up, I'm
You're
using,
you're just taking their numbers and dividing it over 3 phases.
and the reason I'm doing that is because there's generally 14 days between phases, a minimum incubation period. And so it won't overlap, do you see what I'm saying? And so
So on positive cases, you're gonna go 7.
7 positive cases per week.
Hospitalized cases, how many?
That would be the same, right?
And
Also-
ventilators.
A lot of their patients, they'll send home, quarantine at home if they're, younger, healthy individuals, just go home. It's gonna be the ones that need that other care.
And that's the reason why I'm going down these, because that's what I was struggling with, is what exactly happened, talking about hospitalized. I'm not a, I'm not a
I guess
professional of the medical.
The hospitalized
right,
one
I
would be
get it.
7,
so the hospitalized cases would be 7.
yeah.
Yes, 6.5, give or take,
6.33.
yeah, 6.33. Thank you.
But who's counting? So, but are we gonna put 7 on ventilators?
No. We're gonna have
2,
2 on ventilators.
I mean, per phase, because if they have the capacity of 6 ventilators, we're still dividing by 3.
So my suggestion is
Because it's per week.
it is to just
No.
take that to the doctors, have them plug those numbers in, and that'll be part of the document. And we go on to the next, as far as I'm concerned, because I mean,
I hear you.
they're the ones that are going to say what they can handle.
But I think what Mark's saying is that
Approve
they
it with that caveat of the
Yeah,
doctor
we
plug in
could,
the numbers.
if we get to
They have a
the
meeting first thing in the morning, so this thing.
we could approve it contingent upon the
right.
hospital
Right,
put
I
those
think-
numbers.
I think what Mark's saying is that it's like we already kind of have the numbers,
Yeah.
we're just trying to plug them in with this phased approach kind of thing. But we
I
technically
really
have
don't
that
wanna
data.
wait another day.
Yeah,
Yeah, we have that data, but I think that data was for any one of the phases, not to split out on each day. But maybe I was looking at it wrong. That's what they can handle, it doesn't matter what phase they're in, this is what their capacity to handle is this number. It's not split per phase, it's just, they're sort of black and white, we can handle 20 cases.
But the thing
Not that
is,
they really
that
care what phase it's in, it's what their capacity is.
there's an incubation period of 14 days. And so you can't have 20 patients, hospitalized patients for 1 week because it goes over the 14-day period. And so, you see what I'm saying? And so what I think
I don't
we should do-
wanna belabor it any
No.
further, if you want to plug 7, 7, and 2 in, we can do that, I would just suggest that we at least let the doctors know what numbers we plugged in there in case they fully disagree with it.
well, that's, yeah, I mean,
And then-
I think that would be our goal.
Yeah.
To make sure they understand where we got those numbers, because we're trying to basically, we're trying to extrapolate the data and trying to put it into this format the best we can. Because this is what we have, this is the plan, we didn't make this plan, we're just trying to put it in there.
Put numbers in there.
Yeah.
And respectfully,
And hard
hopefully
numbers. Yeah.
they suggest those numbers, so they don't come back and say,
And if they do change them, that's perfectly fine.
absolutely.
Yeah, because it is a living document. It's meant to be.
And so what I wanna do is just do it, and then if they wanna change something tonight, we can,
We can resubmit.
It's a living document, it's
And we-
contingent upon the numbers being confirmed.
and like Commissioner Williams said, we state that in our purpose. And so,
So we made it through one yellow section.
Page 5, top of page 5. Well, no, we're setting the stage. This is good. We'll probably just
That was the
work through
biggest
rest.
section though.
Yeah. Oh, was it?
There's a little more talk about it.
If these management actions points are reached, a hold described in section 3 will be placed on moving forward with any other business sector reopenings and allow time for contact tracing to occur. Based on the data provided through contact tracing and testing, the Lake County Reopening Committee and Incident Command Team will determine the need to continue to hold or take steps backwards until we reach a steady state. Now, the important thing about that is something we talked about last night.
That was the purpose of 11:30 phone call.
We do not, this was, we do not want to step back. We want to take every precaution.
But that committee was the one, the question to James was, who decides if we go on to the next
Who
phase?
decides?
Does this committee give you guys a recommendation?
No.
Yes.
We'll make the recommendation, but the governor is the one that states whether we can move forward or not.
But I think you jump from the committee straight to the governor. The committee makes a recommendation to the board to change and push it on to the governor.
And then we.
And that's kind of how I took it.
Yes, that's the way it, we want
Because
to
that's
make
kind
sure
of
our
what
process.
Baker did, is that they formed the committee. We formed our own committee already. But we didn't have this aspect in mind when we formed that committee. It was mainly just to get people talking and get the communication going. But now we've actually found a dual purpose for that committee in helping us navigate when it's appropriate to move forward to the next phase.
So what I see here is Lake County Reopening Committee and an Incident Command Team will recommend the need to continue to hold or take steps backwards until we reach a steady state. Recommend to Board of Commissioners.
Okay, do you want to change things?
I do, because of that, we set up that committee to make a
Just make sure I get the
recommendation
sheet when we get
to
done.
the Board of Commissioners. So this is our
Yeah.
document, and then
Yeah,
we
it's-
send it on to the governor.
I get what you're saying.
So-
It's a little
so
semantics,
say that
but
again.
basically where it says determine, he wants to change it to recommend to the Board of Commissioners, basically. Because, I mean,
And that's the only word change?
I believe so. Recommend the need,
Recommend to the Board of
recommend to the Board
Commissioners
of Commissioners.
the need to continue to hold or take steps backwards.
And so I'd like to change your word too. On the very first sentence, if these management actions are reached, a hold may be placed instead of will. Because there might be circumstances where the doctors say we're cool, or, you see what I'm saying?
The other thing I need to add in the paragraph before that's not yellow, we need to add Dr. Clark
Where is that?
to the committee part.
Oh, absolutely. No, we should definitely, that's actually some good housekeeping that we should have probably
Judy
shortened
mentioned that to
yesterday.
me like an hour and a half ago.
No, that's good.
And so back to yours, where was you put May in? If these management
Right on the first
points are
sentence.
reached,
Reached, a hold may be placed,
instead of will,
yes.
I'm good with that. We don't, because we don't know what the governor's going to say. He may or may not. With that, next yellow, am I right?
Where were you looking to change that, insert Dr. Clark's? Yeah.
On the
So
committee,
Dr. Clark was on
That's
that,
on the first page.
well, not the first page, but under plan for reopening the reopening committee above that first yellow we just dealt with. Yeah, paragraph about that.
Okay, public
Real
health
approval.
branches.
Monitor the situation throughout the reopening. This group consists of.
So you don't wanna put his name, but
What
His
his title is, what is it, public health officer or?
Yeah, see, because it says public health director,
Well, she's part of it too.
she's part of it, yeah.
So you need to
But you
leave-
need to put in
you
Dr.
need-
Our
Clark's.
medical officer.
you need to leave her in there and add public health officer.
Right, medical officer.
what is the title?
He's our medical officer.
Whatever the actual title is, we have it. That's a good catch, that definitely needs to be in there.
Okay,
Next yellow.
next yellow.
Went for
Page,
PP's.
So I not snapshotted, but snipped this part out of our plan and sent that directly to Quentin. Says, can you help me fill this out? We know how my math was from yesterday, so.
Yeah. I never got a thank you, sorry I was wrong, comment.
I was trying to wrap my head around this part, so. Lucky you didn't get an angry emoji.
you know, I'm not gonna lie,
So
Sheriff, this was a very interesting discussions going on, taking place yesterday. These two right here, we may need to put a wall between at some point in time.
Well,
So.
you know, they do have those ankle monitors with shock in them.
So
That
when
doesn't work
is
real
that
good in
gonna?
power.
I don't know, I sent it to him, I'm hoping I get it in the next little bit, I'll try calling him here shortly too, so. And that stuff shouldn't have any impact on.
No, that's just data, we want to make sure it's.
Yeah, just put it in there.
I'm not
That
insinuating
isn't even
anything, but
really
you run the
trying,
paperwork
we're just
really well.
admin, right?
Paperwork, but-
You're not insinuating anything.
Well, law enforcement.
Yeah. Okay.
You got it.
You're not insinuating anything. Got it. Page 10. So,
Here's the other big section.
this is the other big section, and this is why I'm saying that Daniel is full of it, because
This is
this is
what,
gonna take us a
this is-
while.
This is the section
I
that
don't know,
was
my
you guys for hours and hours, I'm sure, one of the sections.
Well, the thing is that
That's-
at the beginning, when we discussed it, we didn't have the governor's guidelines yet.
We also didn't have Modoc County's plan, which we did halfway through that meeting yesterday. Both Modoc County's plan in California, as well as the governor's criteria, include restaurants in phase one at 50% half capacity.
And so our dilemma was still the same by our medical staff strongly recommending they don't.
The
In the
criteria
first place.
allows it.
Yes.
But if the governor allows it and then the public says, well, the governor allows it, why didn't you guys? We're gonna be
Yeah.
villainized. And so we're kind of in a tight spot because we have to have medical approval for our document to be legit.
So this is the discussion that we're going to need to have with the medical staff to discuss what this is gonna look like, because upon their recommendation earlier on, which we were following, was to not open our restaurants until phase two, even though we personally had reservations against it. Or reservations against that recommendation, where we would like to see at some degree of an opening for our restaurants in phase one. But when we see the governor's criteria coming down, including it, and then we see a neighboring county that borders us in California that's planning to reopen by May 1st and have their restaurants at half capacity, that to us says, you know, you're going to see that influx of population going there for the restaurants, and you know, whether it's Chinese or pizza, where they can't get those services here in Lake County. And that influx could be concerning even. And so we'd like to remain consistent with our neighboring counties. And I think Harney and Malheur are pretty much in the same boat now that this criteria has come down from the governor's office.
I have absolutely no problem with this, and I believe the tools for you or Mark both to make the argument to the medical side is the criteria allows us, we're putting our plan together with the criteria that's coming down from governor's office and the neighboring things. So I think the argument to the medical staff is very legitimate, along with, I appreciate you guys putting in there my thoughts on the outside dining or whatever. I believe it was there. I think you captured it someplace, but,
Well, so I know you brought that up, the outside dining. That was before the governor's deal. And so why would we put something in that was more restrictive than the governor's if she wants to open?
I was just looking for even if the 50%, if they could, it sounds bad, gain another 50% by expanding outside, they could almost get it 100%.
Because it's not interim dining at that point.
Just a thought, but it doesn't have to be.
And they can social distance and remain.
Yeah.
Yeah, and summer coming on, I get where you're going with that, I see, I'm just giving her. But the other thing, I also, is that included in here? Because actually it looks different than it did yesterday.
So I forgot to highlight one spot, and that was the outdoor recreation spot on the very bottom of the same page.
Oh, thank you, we'll come back down to that, definitely.
I don't know what you're looking at, but I just.
So what do you see in there?
I was still looking at the sit-down dining real quick. There was something I wanted to,
So I don't wanna put the pending Lake County medical staff approval.
I was just highlighting it as a footnote, as like a sticky tab to make sure we talked about it.
As basic employees.
And is the employees wearing a cloth face mask a recommendation from the governors?
I believe so.
We need to make sure because
That
if
was
we,
in the guidelines for employees, I can pull it up real quick for you guys if you want. I believe it.
do you see what I'm saying though? I don't wanna be,
Oh, I hear you. Absolutely. I have gotten.
So on, if I'm jumping around on the gyms, it's a recommendation for mask. On the sit-down dining, it says that the employees will wear a mask. Is that where you were going?
and I don't wanna be more restrictive than what? The governors,
Well, and as we're trying to get all our businesses open in a fashion, we have one that says you will, and the other one says.
where do you see the
recommend.
will?
Well, on gyms, it's recommended for mask and screening.
It's just recommended.
Yeah, and above that, on sit-down dining, employees in contact with patrons will.
And that's the question
That is my answer. Interesting, jumping around while I was researching that, on bars remain closed, but there was also within her order is a video lottery, trying to get those open. And generally, in our case, most of those are in the bar.
And so we need to check that new order to see if bars are 50%. Because that might need to be changed also.
So I hate to belabor anything, but this means for our service clubs, i.e. the Elks and the Eagles, which both serve food, both have bars, and both have video lottery. So does the bar remain closed and the dining becomes open? And if I'm dining, can I ask for an adult beverage?
That's one of my questions also. That's why I wanna see.
I mean, it's hard to try to help every
Okay, I got it.
business within.
Okay, so what does it say?
It says employers may encourage employees
So
use
we
of
need to
cloth
change that, Daniel.
of cloth face coverings as appropriate or indicated by sector-specific guidance. And this is
And we probably
is-
should use
this is
that,
directly pertaining to restaurants.
so we need to use that language, the same language as.
The governor.
Employers may encourage
I
employees.
think what we did, we took that part out of Baker County's plans where that part came from.
That's
We moved it from
Yes.
phase 2 to phase 1.
Right,
Got it.
and then we didn't have this information. Can you find bars on there, James?
Is that?
Can you find bars on there?
Yeah, it's on the back part of this one.
No, the governor's.
Oh, I don't think
You're talking,
restaurants.
are you talking Baker counties?
No, that's the
Oh,
recommendation.
bars.
Oh, you got the recommendations, I haven't looked.
Yeah, this only covers healthcare, transit, retail, childcare, personal services, outdoor recreation, and
You want this
restaurants.
to go down to market?
Yeah, it's towards the end of it, talks about the bars and the video lottery machines.
Is that
On the very
on
end,
the same
It's
document?
on the last page or second to last page?
It's the only bad thing about these patents is I don't have a word search. Which is one of the.
So we just wanna change it to are recommended to wear a cloth face mask or encouraged or.
The exact verbiage that the governors, and then just cut and paste or whatever. Is that why you want to mark the exact verbiage of the governor's order.
Yeah, because if we have the exact verbiage, then how is she going to decline?
Is that under the employee guidance though? Employer guidance?
What part?
That part about the video lottery dollars, that's not,
It's in the document that he's got right there.
which one is that? Gotta see. Or,
Which one do you wanna see?
that's,
Okay, so this is says restaurants, bars, breweries, and tasting rooms. It has them all together.
But the last page, that's the video part, right?
yeah, hang on, I'll pull it over. Got it, alright, I got it here. Different, it was a different.
So the
part.
bars are gonna be open too.
Okay, no, Oregon Lottery will not turn on BLTs until the agency is satisfied that all conditions have been met. That's actually what it says, that was, businesses must place BLTs at least 6 feet apart. It cannot be put, Oregon Lottery may turn, is that second last page? Yeah, video lottery terminal operations. Yeah, they have a whole section there where they cover the video lottery dollars.
So Brad, it says, if a business is unable to maintain at least 6 feet of distance, it may operate only as a pickup and go service. This applies to both indoor and outdoor seating. So.
I know right now, I wouldn't mind dining out if they had a place set up. It'd actually be sort of enjoyable, but that's my preference.
So here's another one, and this is the governor's document, correct?
Yeah.
It
Well,
says,
I would say that's the task force that's reporting that to the governor on their recommendations, and that says draft, so subject to change on it.
so, but is this the guidelines from the governor we got yesterday?
Those are the guidelines that James was talking about.
Yes, and this is actually something to take into consideration that this is still under extent possible businesses should strongly encourage all employees and customers to wear cloth face coverings. Customers do not need to wear face coverings while seated at the table. If a business sets a policy that all employees and customers are required to wear face coverings, business management should consult with their legal counsel to determine whether or not such a requirement can be enforced and whether or not business will provide a cloth face coverings when a customer does not bring
See,
it up.
we're starting to get there, man,
So that's, I just,
on the legal stuff.
and this is what,
I'm sitting here.
this is what the task force found, so, and this is, I just wanted to share that with you guys as I'm pouring over this again.
It gets very
So,
touchy on infringing on people's rights.
so the thing, the item that you were talking about where it says operations, businesses must, and it goes down, it has a bunch of different things that businesses must do. But at the very bottom it says, for use of jukebox and coin operations, arcade machines, same protocol should be followed as outlined for video lottery terminals below. And so
Interesting.
that's interesting.
So they don't want your attention on that.
All on-site consumption of food and drinks, including alcoholic beverages, must end by 10 p.m.
Prohibit use of karaoke
Usually when the
machines.
last call comes, you make extra orders, cover for another couple hours.
Oh,
I'll take 3.
4.
Too bad you guys aren't on camera, it's only me that gets the brunt for that. Whenever you guys are in consensus out there in the audience.
They'll
We
hear.
talked to Kevin about that. I told him to do that.
Prohibit counter and bar seating. This applies to all facilities, including bars, breweries, and tasting rooms.
Boo.
See, this brings up a whole other can of worms with the documents.
So do we just throw ours away and send one paragraph we support the governor's guidelines for opening in phase one. We want it enacted today.
I hear you, the problem is that this right here is in draft form, so some of this may change.
So will our document. But what I'm saying is that the only thing we need to change is ours to under the guidelines set forth by the governor.
You're looking at me, Daniel.
Refer to the doctor stuff, that's the only part that worries me.
Yeah, I know.
But
And
the,
like my wife says, drunks have no social distancing capabilities.
Ugly ones do.
it's just the opposite.
Just saying.
Blame it all on your wife, like my wife says. Jeez.
Well,
they
she
make
has
comments
a
like
good
that.
point on that.
Just throw it in. No,
I think I mentioned that a while back on the alcohol side.
I love you, man. So I have a question for you. The government's recommendations say that you can do this, and Lake County said you can't. Those businesses that go ahead and just follow the government's recommendation, is there anything that Lake County can, how can Lake County stop it?
The problem is the medical support side.
See,
We have to have the letters.
But a lot of people aren't gonna think about that.
We have to have
but,
letters.
see, the part of our document for the governor, the governor to approve is
Your
that
business owner read that.
our medical staff, our medical community has to agree with our document to even get to phase one.
Trying to get his blood up.
And
I
so
just,
she's
so we
not, she's
understand
not gonna allow us to go start phase one without medical staff approval. And so none of this will happen if this is the big, so.
But is he
So-
still going to
so
be
Buddy, that
cited
sorta
if he
answers
goes against what
the
you guys
question
say
of
phase
what
one?
we have to follow, that
But then
allows
he doesn't
AG's
ask.
office to that mayor.
And probably. And Brad just got a letter from a senator today that was just gonna open up,
A mayor was.
gonna open up. And the Department of Justice sent him a letter saying, you will be fined criminal charges or
Buddy has it there, it's the AG's office, and there's two sides to that, it really puts it in perspective of, we need to follow the governor's guidelines for our businesses, and make this happen so those businesses can be open. If our citizens and our businesses say, will you vary from that? We want you to vary from it. This shows that we and they can be held.
criminally responsible.
Yeah.
That's the exact words.
And so that could probably be
Individually,
thought at
criminally
some level,
responsible.
whether that's constitutional or meets ORS or whatever, but
I'm saying.
nothing's normal right now.
But there's another side to that.
There's
To your constitution. Go ahead. You articulated it quite well.
So the upside to that is, as we open up and as time goes down the road and things go back to normal, there will be lawsuits where their business is lost, our people lost life, and those lawsuits will happen. That right there helps protect the counties, is that we follow the governor's guidelines. When the lawsuits start happening, it'll go towards the state of Oregon, not
Because
to the
she's,
counties.
See, that letter's taken full responsibility.
that, in that letter right there, the state has assumed all responsibility for any losses or damages due to this shutdown.
And
Which
so-
I didn't think about. Brad had to kind of bring me back down because
Well,
Your blood went up.
there could end up being a consortium of business sector that have a class action suit or anything toward the state of Oregon, I don't know. But I tell you, if and when we get back to normal, there's gonna be a lot of people harmed in many different ways, from medically to business-wise to whatever. And it's gonna be real.
So James, did you get an appointment with the doctors again, with your committee?
I have not heard back from Teresa Squires. I CC'd
Didn't know he was
Daniel and
I'm sorry.
oh, you have no idea. But I'm hopeful that tomorrow I'll know. I'm guessing Teresa won't tell me until the doctors have that meeting tomorrow and they discuss it, and then they'll say, we'll have a meeting.
And then Aaron's been talking to Dr. Hussey and trying to figure out about a meeting. So I know there's a conversation going on at least between Anna and the doctors.
The thing is that, how long do we wait for that? I mean, we got people that are unemployed, we got businesses that are closing, we gotta wait for the doctors.
So getting back to how fast and what's the timeline to get to the doctor for it to be considered for reopening? How is the governor going to decide? And how soon? Is she going to decide phase one for each county? Is there time on that? Do we have anything? If we get it in today, will she decide tomorrow? If we get it in today, will she decide next week? Do we have anything that gives us a guideline?
What I think is she will decide within 14 days.
From the time we submit it, or as a whole for everybody that's?
No, I'm talking from the time we submit, because that's how the phase process is working, and so.
So we submit it as soon as possible, and if we wanna resubmit a change, then we do so. What we really wanna do is get ahead of some of the larger counties that are going to have far more complex and much bigger plans for reopening. We wanna get ahead of them
Please.
for
Want me to see if I can
plans to
call
be
her?
reviewed, because otherwise we'll be stuck in the pipeline.
Make it faster.
Whatever we want.
That's what I feel like anyway. I don't wanna get stuck in that pipeline of being approved and sitting behind 4 other counties with several hundred thousand populations.
So time is of the essence, very much so, because not only would we be waiting on our doctors, the medical team,
And we wanna give them as much time as possible, yeah.
Well, it sounds like a bunch of us will be answered tomorrow.
Yeah.
I told Anna.
but they haven't even seen this yet.
They have not, they can, we can send it to them, we could, I would think
And
we
they'll
can
see
send
it
it to them
tomorrow.
tonight,
Yeah,
say,
we would send it to them.
can you present this to your medical staff and
I would also, if we don't, I would approve this basically contingent on, the reason I say approve it contingent on the doctor's approval, specifically about this sit-down dining, is because of the doctor's feelings about not opening early on. Now, we have additional information since then that changes a lot of that. But, I mean, we didn't have the governor's guidelines yet. We didn't see that Modoc County was going to open, a county in California, that they were gonna open by May 1st, so that does change things.
So for right this moment, let's,
I just wanted to make sure that they have the chance to see this before we fully approve it, because it goes against their original recommendation.
and we have to have their stamp of approval.
Well, and I think the discussion point for that it goes against the original recommendations is that the governor's criteria and others come down, and I think they'd be prudent for them to consider the guidelines that we have now in front of us. I think
It'd be prudent, but it would put us in a pickle. One way or the other, I'm going with opening, and so, do you see what I'm saying?
hear you.
It doesn't make a difference to me, because of, I'm not gonna put this board of commissioners in that place where the governor approves it to be open and we don't open it because of our medical staff. I'm sorry, but
Well, we
there's
are,
no way that I'm going to do that.
so I'm looking at right off as that, is possibly the governor not approving it because the medical staff isn't on board. And so we have to submit the best document for the governor to rubber stamp and get through. And one of those processes has come down to us as the local leaders to work with our hospitals and that. So my theory is to be prudent, is to, if it delays it a day, it delays it a day. I just sent the checks out to find out if they're gonna approve these by order of product. I don't know if I'll get one back. But we don't even know if she's gonna do it all on one day and say everybody's got the plans in, these ones we approved, or she's gonna do it in order. So we don't know if we have the luxury of a day or two, but I don't think we have the luxury of not submitting the very best plan for approval for those businesses to get open as soon as they can.
Okay, I agree with that 100%. But let's just say they don't approve the sit-down seating at the restaurants and bars. What's our plan?
At that point, I think we make the decision to submit what's out there approved.
So what if, to interrupt real quick, what if they said, we approve of all of these other things except for this one item, and then let her decide, you know, in their letter of approval, like, then this is why. And then hopefully, you know, we'll have 90% for approval from them, and then she can be like, well, this is what I think, and so hopefully maybe she can approve anyways.
And that's what we were talking about yesterday, is you put it in there and then you put an asterisk by it. And that section with the asterisk will state that this went against the medical staff's recommendation.
But it's still our,
We're complying with what your
Yeah.
guidelines,
but
and then
we,
maybe put like a line on each one for the medical officer to initial or something, you know, just documenting that this is all okay, but that part isn't, if they deny it.
so basically, instead of saying pending Lake County medical staff's approval, we'll just say that it hasn't been approved necessarily by the Lake County medical staff, and isn't necessarily supported, but we feel that it is in line with the governor's criteria.
Following the governor's guidelines.
And that way,
But we do have to give the medical.
we still need to do that. This pending this was a note for us to make sure that we were
It was to remind us to talk to them
cognizant,
about it.
yes, that we need to continue to
Absolutely.
have that conversation. And the conversation is gonna need to be ongoing, because this is going to be something that's.
It goes right back
That's why we formed the commission.
Absolutely,
And it goes right back to the living doctor.
right.
So this is gonna ebb and flow, correct?
Mhm.
Absolutely.
So,
I-
do we have consensus on that sort of part so we can move on?
My consensus is, well, at least where I'm at, is to reach out to the medical field and make sure that they get asked.
Yes, we will do that.
And if they say no, then before we send it in, we'll have the vote on sending it in without their approval or not.
I think what you're asking though is, can we get a vote on that now, so we at least kind of know where we are, no matter what happens there, so we can kind of save time, basically. If the medical staff, because it almost appears that we're basically gonna go ahead with this, whether the medical staff do or not. We're just looking for their
Well,
blessing.
what comes if you don't get your letter from your doctor? You submit a piece of paper to the governor's office, that does no good. Because if you don't get Dr. Clark's letter to go with it,
And
Yeah.
see, we have to
But
have,
Dr. Clark, basically what we'd be asking for Dr. Clark at that point is a letter saying, signing off on everything else except for this part. Is that basically?
he
what
just
it
needs
is?
to approve the plan, and if he approves it where this, Lake County medical staff doesn't approve this, if he approves that being a plan and going up there,
If
but
it's
he's
tough,
not gonna go against the medical staff. That was made clear.
the problem is that this is part of the governor's criteria and federal.
I think that's why you gotta plead your case to the doctor, saying, now, doctor, picture yourself in my shoes, how would you work around this? And I see sit down dining room saying, yes, we'll do that, but we won't do bars. And then where are you at?
You gotta go by the guideline, Daniel, that's what I'm saying.
You don't have to, it is a guideline.
Right, but what I'm saying is that no matter what the subject, if the governor says it's okay and we say it's not,
But you can be more restrictive than the governor, but it does create you a political nightmare for the citizens out there.
And does open up for potential lawsuits that if you did not include a bar, and you did a restaurant or a gym or whatever, a church or whatever else, and you harmed me financially by not following the governor's criteria.
Which is why
That's why
it's
you're-
important to follow that
nailed it,
guidance.
Brett.
So your best course is to get the doctor on board with the guidelines.
Yeah, that's where I am. I think we'll have a decision to make, Mark, depending on what goes on, but out of respect for the professional medical field, I don't want either one of you or me going before them with an ultimatum. Is we need your support. Please give us the support. If they don't, then it comes back to us before we adopt and send it in and make that tough decision. But if we go there and say, we're sending it in whether you support it or not, then we'll say, okay, we don't support it. That's the way I feel about it. I think the tools are there to have a professional discussion with the doctors, and you got the governor's guidelines, you even have this letter here, and you have all that stuff that says we really need support for this part of our economics for our community. And those things have changed since a week ago whenever you met with the doctors.
Yes.
And so that's where I'm at, just straightforward, having that professional conversation. I think it would be the committee getting back together. I really do, if you can make that happen. I know that it's another day, but another day now compared to our plan being rejected and it being 2 more weeks before businesses open up, what's the trade-off? Possibly. I guess that's what I'm trying to think out past the moment. And
The problem is that, like I told you earlier, you know, I had a phone call with Representative Owens again this morning. He wants to, Malheurs is done today, Arneson was done yesterday, and he wants to send all 3 of them and do a public announcement today if possible.
and I appreciate the political part of it. I appreciate it very much. But it does not get our restaurants and things opened if our plan isn't improved. So I appreciate him being inclusive of us very much, and I would love to make that guideline. I would love to make sure we get there, but I'm trying to think of our constituents that need those businesses open, and this plan is the only way to get them open at this time without violating the law and saying open up. If we do that, then we become liable. So this is the hand we're dealt. And I would love to make that time frame, Mark, I really would. So that would mean if there's anybody has connections with the medical side that could help make a decision today or this evening or first thing in the morning. When does he need it by?
He wanted it by today, but that's why I'm so adamant. Other than our businesses are,
Yeah.
that's one more day without.
Yeah, and see, so I'm probably not as political as I used to be. For me, that's a nice guideline to make, or timeline to make. And I don't wanna take away from all the hard work on this, but it seems as if there's just a little bit more that needs to be another box checked.
Have you guys discussed having like a virtual meeting? You can host it on our software and you can screen share and
I'm with anything, but the thing is that we can't even get anything.
I want to take a 5-minute break. I'll make a call, try to get them narrowed down when the governor is going to do that. All right, is okay with that?
Are we taking a break now?
Break. Okay, so I have no information. So we'll come back into session at 13 minutes after 2. I wasn't able to recover any information on the time frame that the governor will go with these plans. Still working on that, so maybe as we continue conversation, I'll get a text. Interesting, I have to throw this out here, just had the museum curator ask me a question on my way back in. When will museums open back up, or will they?
Was that?
So I need to step out again, I'm getting that call.
Okay. Recess.
The session at 2:13. So I was able to reach out to Annette Leva at her level. And at this point, the governor does not through the matrix and everything, have an absolute date that she'll be reviewing these, to her knowledge. And that all the matrix and everything has not even been really finalized within the governor's office itself. So there's, I asked if she knew if it'd be by submission that'd be reviewed, or if that they would all be reviewed in one date, and these ones pass the criteria, and these ones don't. She could not answer that because that has not been said yet.
Yeah.
But I did mention how we were trying to make sure that we follow the governor's draft guidelines and everything.
To a T.
Yeah, and she obviously thought that was a very good thing that we do that. So we got no date, so the essence of fastness is that you would like to meet is to show Eastern Oregon counties are unified and getting and doing what is requested of us. So I guess with that said, as we go through more of this, we have almost come back to, we approve this in a way that's contingent upon some further meetings and further documentation, I guess, would be one way to get it through by this afternoon, Mark. And we haven't even got all the way through it, but that's, I'm just trying to push that.
I'd like to submit this in draft form for the other counties to look at if there's anything that they feel like they could maybe fix in theirs that they'd like about ours. Because honestly, I feel like we're ahead of the game on some of this. We bullet point a lot of this out, whereas Baker County was more of a story kind of format. And I feel like presenting this to our fellow counties and letting them see this would be nice.
You know, you just nailed it as far as I'm concerned. The one word that I never used or anyone used is we can give this to Representative Owens in draft form.
Correct. And that way, and actually, I think that if we can get the representatives and senators behind us and just presenting the draft form of it, so that they can see this is what we're doing, they might be able to push forward an actual date of review.
In draft form, we're saying we need to be able to have a date that these are gonna be reviewed, and so our businesses and others are able to look for a date they can start tooling up or gearing up.
Right. And by consensus of this board, we approved the draft as is, basically.
I still think we need to put an asterisk by those particular subjects
That's
saying,
That, and we can even
Hold it.
articulate that's the reason why it's in draft form.
Well, I
Refer
think
back to those asterisks.
we could, instead of pending Lake County Medical Staff approval, pending Lake County Medical Staff review.
Exactly. Good verbiage. So that's,
I'm totally fine with that. I mean, that's,
so did we had,
But we need to add those recommendations for the bars to our section 2, because right now it says remain closed, right?
so,
because of the governor's guidelines.
so I'm gonna throw this out here at the very end, if this is something you guys, or we should consider is, a note at the end of it is, this is to the governor, if not accepted, please refer back to the board with changes or the deficiencies that are within this plan. Because I would hate to get it kicked back to us in,
Nothing, no feedback.
yeah, but that would be,
I
Like if you're going to reviews it, I wanna know why.
yeah,
Got it.
in a professional way, and if that needs to be the verbiage changed a little bit, I'm not a writer, but I'd like
I
to,
like that, Brett.
I
You
like
got that, Daniel?
Which part? The last part? No, I'm gonna take his sheet when he's done.
Are you having flashbacks to yesterday?
get out the big board.
I'm trying to remember the camera's on.
Okay.
Yeah, I know.
I can remind
I'm sure that the governor's office plans that they would give us that, but We just
I love
just
that.
have it in there.
I would request it straight up.
And then that way it makes it, it kind of puts it on them, for one. Two, it allows us to make the changes requested by the government.
That means everything else is good.
Right.
And we don't have to work on those.
Right.
Those,
Bullet points.
yeah, the changes or deficiencies within it. So that's the only other thing I had on it.
Okay, Daniel has something.
The outdoor recreation sites at the bottom,
Rick,
how do we wanna verbiage that, because ours are open, but I think your take was probably taking on the federal side, I'm guessing.
And we were talking about putting that into a request.
It was a request, remember?
Yeah, so it's outdoor recreation sites, all outdoor recreation sites could open as long as social distancing.
I think we'll just start that sentence with
Outdoor
request.
Yeah,
site
actually use-
request. Yeah, but yeah, your title would be requests, and then,
And then a drop-down bullet would be outdoor recreation sites. And you might even include in that, upon approval of the overall plan. Or upon the, I don't want to say that.
So- go
You
ahead.
guys,
You know this hits home with me hard, this one here, but
I do, I was just going to throw in there what we were just talking about prior, that you put in that other request as far as giving us feedback if this plan isn't accepted. for any reason.
copy.
And
So
you
they
put
both be
those two
together.
requests in there together, that's all.
on,
Go back to the recreation, it sounds like.
yeah,
that's
on the outdoor recreation sites, we're generally and only able to talk about ours and the states. The federal sites that I'm so upset about, if this is in here, that should be a guidance for the federal to open up their, that has to come from the Fed side. The state can't tell the feds you're going to open up your boat ramps and everything and all that. But there's so many state parks and state boat ramps and counties that this gives guidelines for that. And hopefully those guidelines, the federal would adhere to at least.
So you're just saying that you're mostly upset about the federal
That's what
side,
affects-
not the state.
Within Lake County,
The federal ones in Lake County.
because
Are there any ones that are actually ran by the state that you're upset about on fish and wildlife or anything? Or?
Yes, somewhat.
Okay, so I
We,
would,
we have state parks that are basically shut down, that I think social distancing is
Would be-
acceptable. We got Fort Rock State Park, we've got Chandler, we've got these others.
Goose Lake State Park.
Goose Lake State Park.
Every night.
A lot of my angst comes on the federal because I use the federal more for my personal use. But the state parks and everything need to get open by some guidelines within Lake County because of our amount of use is less than the coast that has state
Did we
parks.
put that in there?
well,
That was one of the.
that's at the bottom of page 10. If you
No,
want,
but didn't we put that in the recreation ask? Because we said yesterday that because of that, our sites don't see as much traffic as.
Yes, we did talk about that, but I did not put that in there.
So we did bring that up yesterday. You see, what I'm thinking is,
Daniel's on the time crunch, he's got.
I think Melanie too.
so, real quick, so the feds didn't shut anything down until the state did. And so I'm assuming that if the state opens, they'll immediately open. That's what I'm trying to get leverage with.
I agree, I hope so. I asked for in writing that the local forest supervisor would have authority, never received it.
I think that's something we mentioned on this 2:30 phone call.
And then they're planning on the state's planning on addressing opening on the 5th,
The feds,
the
the state,
opening state parks.
and they haven't even gave us guidelines of whenever she's going to
That's when they're gonna
review our
start,
plan.
well, they're
Then
gonna
we'll
start
open the state park.
considering.
Well, they're gonna start considering it, whether it happens on the 5th or not.
Right, no, it'll probably be,
So Mark,
Well, I'm all for it, but I mean, I'm frustrated, my words were a frustration that we don't even have a date that's gonna review our plan.
so do we wanna start the meeting or do you guys want me to go a different room?
So, I would say where I'm at on this, by consensus of the board, in draft form, we can submit it in draft form. And which one of you are going to meet with, you're going to go back to the committee and meet with the doctors?
Yeah, I can do that.
And then I'm,
And are we good with that? And that would get your
As soon
in
as they
draft
tell me
form
when.
to Representative Owens. So there's somebody who's gonna be doing some typing for fast to get that.
Daniel, do you mind if I tell you the OEM call?
that'd be great.
So we're
Yeah.
done, we're gonna
Yeah, I-
You
recess
can use my
this
office or we can go right here.
and leave open in case we need to come back any of the rest of the week.
Oh, yeah,
Okay.
We're
Yes.
recessed.